I will be discussing our causal tree map. The causal tree map process is used to define a timeline that starts with an event and the occurrences that precede it. These occurrences show the cause and effect relationship of how each error may lead to another. By defining the root cause of each occurrence when following the tree map, we are able to find a classification of the root causes or the underlying root cause. For our case study, the key contributors we found were the people, policies, and the lack of information and support from management that should have occurred. These key contributors all point to a lack of policy, communication, and education from staff on giving and receiving reports, handoffs, and SBARs. The first key contributor I will be discussing are the people involved. All of the staff that are responsible for caring for JB all claim to have been busy due to tending to other patients. Staff must be more aware and mindful of the patient that they are caring for and the environment around them so that these situations may be avoided in the future. In order to effectively care for patients and overwhelm staff, there must be communication so that additional staff, such as a charge nurse or patient care assistant, may help. The first way to communicate effectively is to understand, know the importance of, and be able to give and receive reports, handoffs, and SBARs. By educating our staff that reports are important and necessary when transferring the care of a patient, we will then increase patient safety. The second key contributor are the policies that are set in place, or lack thereof. As the transporters took the patient without receiving a handoff, the night shift nurse not giving the radiology technician report, and the radiology technician not checking the patient before the transporters left, it is evident that there are no policies in place to prevent the transferring of a patient without giving or receiving a handoff or report. By implementing a policy, all staff would be required to give or receive a report before giving or taking a patient to another department. This will also help keep medical staff up to date on the patient's condition, what they should be aware of, and the possible emergency situations that may occur. Finally, the lack of information and involvement from management is evident due to the lack of communication from patient and spouse to the nurse, from the hurried call from the nurse to the on-call physician, and from the nurse to the charge nurse about their patient load. In order to increase the amount of information given from each member, each party should ask questions to receive the full report and the status of the patient and advocate for themselves and for their patient. By doing so, the nurse would know how to better care for JB, the doctor would know more about their patient and their prognosis, and the charge nurse would know that the night shift nurse is overwhelmed and not equipped to handle this patient load that created an unsafe environment for each patient. By encouraging communication, advocating for the patient and themselves, and implementing policies and education for patient handoff, reports, or SBARs, these situations can be avoided in the future and patient safety will be increased.